Kim Greeno. I'm one of the Elmira City School District nurses, and today we're going to be demonstrating some techniques and protocols that we're going to have in place for the upcoming school year. A couple of the things that we're going to go over today are going to be proper hand washing techniques, proper usage of masks, proper social distancing, and proper protocols for getting temperature screenings for students and staff for the upcoming school year. Safety measure that we're going to review is proper hand washing technique. Hand washing is easy, and believe it or not, it's the most effective way to prevent germs. Clean hands can stop germs from spreading from one person to another. So my assistant Lois here is going to demonstrate exactly what we're going to do. So there's 5 easy steps for effective hand washing. The first one is wet your hands with clean running water. Turn off the tap when you're actually going to wash your hands so that you can conserve water. Apply soap. You're going to want to lather your hands together with the soap. Lather the back of your hands, between your fingers, underneath your nails. You're going to want to scrub your hands for a good 20 seconds. A perfect tip, especially for our little ones, is to hum the happy birthday song twice. That will ensure that you have done 20 seconds of hand washing. Once you've completed your 20 seconds, you're going to want to turn your water back on and rinse with clean water. And once you've rinsed all your soap off, just use a dry, clean towel and thoroughly dry your hands. As I stated earlier, hand washing is the most effective way to prevent the spread of germs. We want you to wash your hands often throughout the day, but especially after touching your face, touching multiple surfaces, touching multiple items, after preparing food, before and after meals, after using the restroom, and of course, after coughing or sneezing. While soap and water is the best way to prevent the spread of germs, if soap and water are not available, you can always use hand sanitizer. We do recommend that with any hand sanitizer that the alcohol content is at least 60%. Now with this one it's 70. So you're always going to look at the active ingredients on the back of your hand sanitizer to ensure that it's at least at 60% alcohol. All you do with hand sanitizer is 1 pump. Rub hands. Make sure you're rubbing all the surfaces of your hands, between your fingers, between your nails, until the hand sanitizer is dry. So the next safety measure that we're going to demonstrate for you is proper use of masks. We're going to show you the technique for using a paper disposable mask and a permanent cloth mask. Now before you do apply your mask, we always recommend that you wash your hands. The first demonstration that we're going to show you is proper use of a disposable paper mask. You're going to want to grasp both ear loops and place directly over both of your ears. You're going to want to pinch the metal clasp in the top of the mask so that it fits properly over your nose, and ensure that the bottom of the mask is pulled tightly over your chin. It's very important with any type of mask that your nose and your mouth are completely covered. Now in order to remove the mask, you're just going to do the process again. Grab both loops, pull the mask forward off of your face, and avoid touching the front of the mask as this can be the most contaminated area. Once the mask is off, go ahead and throw it away. So the proper use of a cloth mask is basically the exact same as a paper mask, except cloth masks can be reused. We do recommend that if you've worn the cloth mask all day, it's wet or it's obviously soiled, that you're going to want to take it off as soon as possible and get it washed. Now, if you've only worn the mask for a short period of time, it's not wet and there's no obvious soiling on it, you can actually store it and reuse it. So we recommend that you either store it in a paper bag or a plastic bag. We recommend that you label the bag's front so that when you place the mask into the bag, you're placing the front of the mask in the front of the bag. So when you actually take the mask out, you avoid putting the contaminated part of the mask onto your face. So the CDC has identified the following symptoms as potential symptoms of COVID-19. We ask that parents or guardians monitor their children for any of the following symptoms and please keep them home if any of these symptoms are displayed. Fever or chills, fevers of 100 or greater without the use of fever-reducing agents, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, and or diarrhea. So the next thing that we're going to demonstrate for you is what a typical screening upon entering the building or entering the bus is going to look like for students every day. We want to remind parents and guardians that this is the second step of the screening, as the first step is going to be monitoring your child for any signs or symptoms listed for COVID at home. If those symptoms arise at home, please remember to keep your students at home. So on a given day, students will be lining up either at the bus or at the front of the building. Students and staff waiting for their screening are going to be appropriately social distanced at least 6 feet apart while waiting for their screening. So each morning upon arrival, students and staff will stand again socially distanced with maintaining at least 6 feet apart. Their temperature will be screened. Normal temperatures, staff and students will proceed to their classroom. And again, should a temp be elevated, that red warning light's gonna flash and the screener can radio their nurse to come down to continue the assessment of that staff or student.